Hi, I'm Firefighter King with Heartland Area Fire, and today I'm going to talk to you about our Autopulse, which is designed to take the place of manual CPR in the event that a patient has a cardiac arrest or some type of cardiac issue. So I'm going to go over that now with how we place the patient and how this is a really good life-saving device that we can use to really provide better compressions, better depth with our CPR, and give that patient the best chance of survival that we can. And this unit comes with a backup battery here, and then we also have a battery placed into the machine here. So we always have a battery charged and ready to go in the event that we would need that. So the first thing we would do on scene would be to turn it on, and it's going to initialize for us. Pull up the life band and place a patient, and there's designated spots on where we need to place the patient on this device. So we need to make sure we get that correct and align the patient properly, as you can see here. We also have a band that we're going to place just to make sure the patient stays secure during the process. So now that that's secure, I'm going to start our Autopulse. And it's going to ask me to lift up the band. We're going to make sure the patient is properly positioned, and then I'm going to press restart. Now it's checking for alignment, and as you can see, the compressions have begun. And this is going to do that at a ratio of 30 to 2 to make sure that we're getting the proper depth, that we're squeezing the blood and pumping the blood through the heart and throughout the body to give that patient the critical time that they need to make sure that they can survive that incident. So as you can see, it works very effectively. It can help us a lot, especially if we are short-staffed and we don't have a lot of firefighters to do CPR. And once that's complete, we could then transport the patient, and the whole Autopulse system is set on this cart that we could then pull out. And as you can imagine, the patient would be stretched out, and then we can proceed to transport the patient via the handles that we have here and other firefighters or EMS folks that are on scene. This is another device that we use that was given to us from a teenager named Lucas, who has also donated several other of these machines to local area departments, and it's going to allow us to provide much more efficient and quicker care to patients with cardiac events. And the bottom part of the Lucas is placed underneath the patient. So once we get the patient set correctly for that, we're going to come over to our Lucas machine, take it out of the pod, and power it on. Once it's on, we're going to make sure we place the arms and attach them correctly. Those are clicked in. We're going to reassess the patient, make sure they're still positioned correctly on the bottom board with their armpits just above the board. Place the suction device, and that needs to be set just above the lower portion of the patient's sternum to provide good compressions. Once that's in place, we're going to have it start at a ratio of 30 to 2 compressions, and we're going to have that operate. So once we see that we're getting good compression with the patient, providing adequate blood flow, buying that patient time to get to a higher level of care, we're going to then strap the patient in and make sure they're connected so that they don't slide out. Great device, great technology. Once we have the patient placed, then we also can use these straps for the patient's arms, and that just helps kind of hold them in to the board and keeps their arms out of the way so that we can operate and provide other life-saving options, things like oxygen and rebreathers and things like that. Very happy to have it here at the department and look forward to using that in the field more and more.